Hello, everyone. Welcome to Problem Solved, fixing last mile engagement in healthcare. I'm Shub with Predict Health, and I'm really excited to welcome Walt Burkhartsmeier as our guest today. Walt, as many of you know, is a well-known and highly respected operations leader and strategic thinker in the Medicare and Medicaid space. Has been working with large swaths of Medicare and Medicaid populations and having a huge impact. So welcome today. Welcome, Walt. Welcome to the show.
Wow, thank you. That was lovely. Appreciate it.
Great. So, Walt, for the benefit of our audience, can you share a quick overview of your background and current role at Care Oregon?
Yeah, happy to. Thanks, Shub. Gosh, I started 30 plus years ago. I've spent the entire time here in the Northwest, Pacific Northwest market, primarily in Oregon. Started with a local carrier in the mid 90s. Got into leadership right away, primarily operations. I've done it all. Worked at that company for 21 years. Moved on to another local carrier for about 10, where I had the experience of running Medicare for a period of time. And now, as you mentioned, I'm here at Care Oregon. I'm the vice president of operations. I've got claims, customer service, provider experience, payment integrity, enrollment, config. I've got it all, Shub. And throughout it all, the theme for me, at least in my heart, has been Medicare and Medicaid. I've danced with individual ACA and ASO products, but my heart's always been in Medicare and Medicaid.
Great to have you. What tremendous background and an amazing vantage point. Speaking of Medicare and Medicaid, we live in a rapidly changing and uncertain environment today. What are some of the top one or two challenges that you are seeing plans face when it comes to the organization, as well as when it comes to last mile engagement?
Yeah, well, I don't think we're unique. I don't think the Northwest is unique. I think utilization has spiked significantly since the end of COVID. People tended to defer medical care during COVID, and so we're still in that space where there's budget shortfall. There's concerns about how much money do you have for your bid, and then you add on the ambiguity politically, nationally, which bleeds into local environments. I think those are top of mind for almost probably any carrier across America. But when it comes to like reaching the member last mile, I think like now's a good time to talk about that because it's bid season, and making sure that you've got the voice of your clientele and your customers is critical. I've said this before. It's almost like you have to have them on retainer. Having a quarterly member advisory panel is great, third and fourth quarter, but things change and people's needs change. So I think it's making sure that you dedicate that time to getting that member's voice. My parents' experience isn't going to develop a bid. That's just one perspective. You got to have it all.
That's great. When we were talking last, you were saying that plans are experienced going through these changes politically or with budget shortfalls or budget pressures. Why is this time different? Why does it feel different?
Oh, that's a really good question. So that's a good question. So I mentioned, the deferred care during COVID and then the spike in utilization, which was very challenging. And, we saw a lot of carriers exit the market for 2025 in the Medicare Advantage space. And then you have the budget shortfall, which we deal with in this industry. Our industry it's built on highs and lows. We're at a low. Hopefully, you structured yourself during your high for your low. But honestly, the current national political environment, particularly with Medicaid and Medicare being so ambiguous, you almost don't know what your next move is. And so, you know, making sure your foundation and your structure, whether it's financially, with your products, your leadership, what have you, is the right place to focus. You got to find efficiencies where you can have them, and um, your technology partners and your supplemental benefit partners are going to be critical in helping you, be efficient, spending your money appropriately in the right places, and serving. Ultimately, it's about serving our membership. So if you can do those things, if you did those things during your high, you're probably doing okay riding out the utilization levels at the moment. But the ambiguity nationally is sort of scary. There's big words being used, and I don't want to call them threats, but they feel like it if you're in the industry. Um, you just got to kind of fight through that stuff, or maybe just, you know, focus on what you can affect today that ultimately serves your membership and keeps your company viable and stable.
Right. That's great insight. You talked about having the foundation really strong. And this is both on the product side, the leadership side. Let's dig in there a little bit more. Let's talk about the leadership, because you've worked with large number of teams, large number of folks. What do you look for as you think about your leadership and you're building your team?
Yeah, that's a good question too. I've had a little bit of experience here with three different organizations in the Northwest. Most of them have been very good, whether they're faith-based or mission-based. And I I'm more comfortable in organizations that are mission based. So Care Oregon, we are founded by the community for the community. We're fully nonprofit. Our focus is on the people with need. So it's Medicaid and DSNP are our two populations. And everybody from the CEO down drives to that mission. That to me is important. It's important for me daily in my mental space and my ability to be good at my job. I've also worked at an organization where you didn't really know if today we were gonna focus on ACA or fighting fires. Fighting fires was the daily routine, which is, it's unstable, and you're not really sure what your next move is and where am I focusing. um, so to answer your question, having a mission driven focus, whether it's you can focus on ACA business, that's great, just don't get distracted by dental or something else. So I hope I'm answering your question. It's for me, it's mission driven, focused, objectives and leadership from the top down, and we
Right.
talk about it all the time, constantly communicating, reminding ourselves that our mission is to serve those in need.
That's helpful. That's great, and really helpful. Um, you talked about the Medicaid market and the DSNP markets. Those are both very diverse markets, different in many aspects, but similar as well. As you work across these multiple markets from Care Organ's perspective, what barriers do you see making member engagement, keeping the member in front and center, more difficult?
Yeah, um, let's see, barriers to the membership. I'll put it this way. So Oregon has a coordinated care organization model, the CCO model, and essentially you've got carriers that are serving specific regions of the state of Oregon. These CCOs, excuse me. That model, in my time so far at Care Oregon, has shown me that each CCO is like its own little entity in its service area. And so what that does allow us is to sort of break down some of those barriers that are natural in other sort of carrier spaces because we're on the ground. So each CCO, let's say, serves Multnomah County of Oregon. That CCO is in that space working with and coordinating with social services, directly connected to the provider network, boots on the ground with counselors and other social services directly connected to the membership. So I know that's sort of a different angle to come at your question, Shub. But it allows us that direct connect. And then we've got, of course, member panels, member advisory panels, provider advisory panels. And so there is a connection there on that CCO model. In my past, honestly, breaking those barriers was, it was my issue or it was leadership's issue. It's so easy to get spread really thin in leadership when you've got a giant portfolio of products and then all of a sudden it's bid season and you're like, well, what does our membership think? It's utilization data is just one part of the story. You have to have that direct connection with your membership, and a variable membership, not just baby boomers or disabled or what have you. You've got to have a really good mix to get the voice of that
Perfect.
of your customer.
What strategies or approaches have you seen that have served you well to stay focused? How have you been able to keep the focus on what's important, keep your priorities for the team itself, your team, so that you're always on point?
Yeah, for me in leadership, it's been easier coming here to Care Oregon because everybody I have found that I work with at all levels is passionate about serving those in need. Um, I had that at my first employer, which I started with in Seattle and came down here to Portland with. It was just vision and mission, and it's kind of a mindset. I'm not thinking every day about you know ROI. It's important in what am I doing in the revenue space? You have to have that, but I think more than anything, Shub, it's a commitment to the community and it's a commitment to our population that really drives my leadership and my leadership approach and style. When in my experience, when you have, you know, 4 or 5 different executives that lead different products and they're all coming at you the same time, it can get very confusing and it can get stressful and one product line might lose some amount of attention and resources. And so for me, coming to Care Oregon and being able to solely focus on Medicare and Medicaid has really sort of driven the way that I lead, and it's based on the leadership that I get from the chief level here at Care Oregon.
You wear multiple hats. You cover a large swath of the Medicare portfolio, Medicaid portfolio. How do you how do you allocate your focus and your team's focus? Do you?
Yeah, really good question. You're right. I have a fair amount of accountability here, and the truth is, I try to lead from a fairly high level. I get into the weeds in all the spaces where I can, but I have to lean into my directors. That's it's it's critical. If I didn't have great leadership working with me, we wouldn't be as successful. And so, I've mentioned this to you before in our personal conversations. A huge something that I very have a lot of pride in is my development of future leaders and people that I get to work with. And so, you know, developing folks at the director, manager, supervisor, and other levels is really what I lean into, um, to be successful for Care Oregon and for the membership here in Oregon.
And that's paid off well. A large number of them are have moved on, and as you've as in other organizations, and have been really successful there as well. And what's your guidance for leaders in your role at peer organizations as they think about this myriad of challenges you're facing, this changing priorities that you're seeing? How do you guide your team through this uncertainty?
Yeah, that's another good question. I firmly believe in servant leadership. It's the only leadership style that I sort of react best to, and so it's what I employ. And it's what I'm very transparent and honest about with my folks, and they know where I'm coming from. I try to be as inclusive as I can. I don't approach situations as a dictator or I'm telling you what to do. And I think that people react better to that. Productivity seems to be better. And so I really believe in that leadership style, Shub. And thankfully, that's what Care Oregon believes in as well, and organizations I've worked for in the past. It's also I've talked about people being on the same page, that knowing that our objective every day is to serve DSNP, Medicare, and Medicaid patients. And when you approach things that way, they know that you're dedicated to this population and membership, and you have that servant leadership approach. Everybody is just seeming to swim in the same direction. And something I learned early on from one of my leaders was always assume the best. If I get an email that's got some challenging tone or content, I just assume the best, and then my response is going to be professional and productive, and from there on the relationship is just going to work out. So I think I answered your question.
Yeah, I think no, that's great.
Yeah.
Great insight. Um, Wanted to focus a little bit on the last mile engagement of members. And uh, Oregon and the markets that you guys are in is a highly diverse population. Both you have rural side, you have concentrated urban areas. How do you tackle engagement for these large swaths of the population?
Yeah, you mentioned the different sort of makeup of the state. And, when you and I first met, I was running Medicare and having real challenges with a giant, um, space in Oregon, Eastern Oregon, where it's vast and it's a different culture. And communicating with people is challenging, let alone, marketing products and reaching the people. Whereas here in the city, um, while it's very competitive, it's a little bit easier to reach your people. And then I mentioned the CCO. So here at Care Oregon, we've got two CCOs that we own outright, and one that we share with other carriers here in the Tri-County Portland area. Um, you know, I alluded to this earlier. It's bid season, and we all know that. And you got to get the voice of the customer, and we can do that in the CCO space because again, we're on the ground, and we don't just have partnerships. We have contracts with social services and different city-based organizations that serve members and houseless people. And so it's a little bit easier to get that voice. It's easier, but you got to do it timely and you have to do it right. I mentioned where I used to work. It's really easy to let an actuary tell you what your products need to be because you've got a limited budget. Well, that's one component. And then you've got utilization's going to tell you a bit of a story too, but that's not all of it either. You've got to have the voice, whether it's a member advisory council or something in that space. But like I said too, you almost need to do it more than you can. And if you were able to have some sort of model where these members were on, like I said, a retainer type of arrangement, boy, that would be amazing. If you could reach out to a group of members, a diverse group of your population in the middle of your bid to ask questions, that'd be powerful. But I really believe in member and in provider advisory councils, and I don't believe that a bid can be purely based on actuaries and experience. I think you need more.
That's great insight. I think we've seen examples of when it's solely based on just on actuaries, data changes, markets move, population needs change, and then you're left really stuck.
Yeah,
Utilization is always backward looking. So really, how do you get the on the ground
right.
feedback? You mentioned something about the provider feedback and building that in. Can you dig in a little bit more and say how you have incorporated that into your thinking? Because they are a key player as well.
They are critical, frankly. Um, yeah, we've got the first thing that comes to mind is we have an IPA here in Southern Oregon. I mean, the CEO of the IPA has my email address. We email back and forth fairly regularly. And sometimes the email I might get from the CEO, is challenging. Well, Walter, why did your organization do this? Why did you do that? And we work through that. But I think more importantly, there's insights into the different clinics and the provider groups within that IPA. What's happening in Southern Oregon that maybe we don't know about in Portland? And that might directly lead to a product conversation or a product strategy. Um, you're going to upset your provider network at times, whether it's because of a federal ruling or a local state ruling or a budget issue or coding rules and practices. And so if you have those relationships, some of those challenging conversations are a little bit easier to have. I mean, they're never easy, but you know what I mean. It's you've already had the relationship and the partnership, and so your conversations are reality and they're professional, and they're based that way. So yeah, and we've got some big provider groups here in the Northwest. Not just your integrated, network like a Kaiser, but we've got similar groups here like that, and they can throw a lot of sway. They have a lot of impact, and so provider relationships are critical, critical.
Couldn't agree more. We've seen organizations that have, as you said, close communication, open communication with their provider groups, or key provider groups, key players, have traditional, significantly accelerated success in making changes, bring them along, coordinating the care ultimately for the member and the consumer. You'd mentioned the member advisory groups and the consumer advisory groups. This is something that we see as being really powerful. But from your perspective as a carrier and a plan, you guys already have a lot of data about members. Why isn't that enough? Why do you need to have advisory groups on top? What's your experience?
First, the obvious is you make eye contact and you get direct feedback. I mean, how valuable is that? I mean, we're human beings. We need eye contact and communication and interaction. And I think you're going to get a real response, especially if, they have to feel safe, and they have to feel and know that it's an open forum to provide real life experience feedback. Data is not going to give you that. You can do a lot with data, don't get me wrong, and it's important. But I really believe that looking at it's like going and seeing my parents, right? It's different from talking to my mom on the phone about how my dad is doing. I can go see their experience, their life, and have a real conversation. And my mom might share a little bit more with me when I'm with her than when we're just having a phone conversation. Um, but back to the member advisory groups, Shub, I alluded to this too. We all know that the baby boomers are really filling the Medicare space. You can't just have that. You've got to have a variety in your group, like a Medicaid population. A Medicaid population is so diverse, um, and you need that in an advisory group, so you make sure you're getting all angles and not just one or two different perspectives.
Absolutely. You really the point that you made is critical. You get the video of the experience than just the photograph and the snapshot through data. You talking about strategies and approaches you've seen work well, tackling engagement of a diverse population. You could talk about the Medicaid world and also the DSNP world. Can you share an example of one or two that has worked for you? And what was the outcomes that you measured?
Yeah, I'll go back to my previous uh, role when I was running Medicare. We really leaned into the data, which again is very informative in utilization. So we thought that our dental plan was sufficient. And I've alluded to this too. Portland is a very competitive market in the Medicare space. Um, but when we met with our membership, that was one of the primary components of feedback we got. It was that our dental benefit, our supplemental dental benefit, wasn't sufficient. And so it just gave us a different perspective. It's easy to look at what your competitor products are. It's easy to see what their out of pocket is and their benefits. You get their utilization later, but it just didn't inform everything that we thought we needed to know when we were building that bid. And I think that the table stake supplemental benefit spaces are great examples of where you need that additional feedback and input, whether vision, dental, and hearing. Again, it's easy to look at your competitors and what your products are in the market. Are yours selling? Is somebody else's selling better? Is it because of dental, or is it for some other reason? Sometimes it could just be brand recognition or marketing budgets. But when you get that member and they specifically tell you, no, your dental benefit was insufficient, it was a reality check, because we thought it was great.
Again, yeah, getting that feedback in a timely way is
Yeah,
absolutely
exactly.
crucial. Yeah, and it's surprising because every executive leader that we speak with, and through time, has talked about how important member engagement is, and you guys get pitched all the time. You personally will be pitched maybe multiple times a day from some vendor or some solution. But why do you think this is still a problem?
Oh, I've alluded to this too. It time, energy, opportunity. It's really hard, Shub. I There are times when I'm like, I don't realize how thin I'm being spread and how busy I am. And so you need that voice, that reminder that, is what you're focusing on right now, Walter, a priority over your actual membership's voice. Get back to that. Like sometimes that reminder is critical, because it's really easy, Shub, to say it's 2025. The data is going to tell me the whole story I need to hear. And it's just simply not true. And you might miss something. And if you miss something, it's 16, 18 months down the drain. And
Right.
so, reminders, um, making a list of what is important and what is a priority, and just making sure that you follow it. Um, but I think these days it's really easy to say, well, the data is going to tell the story, the utilization is going to tell the story, and that is part of it, but it's not all of it. And we have to remind ourselves that the people we serve, that's the message that we need to be hearing clearly and more often.
It's a great insight. Uh, Wanted to switch gears into the look forward into the future and get your guidance for your peers and other executives. So, what do you see as an upcoming challenge for plans and your peer executives as they look forward to the next 6 to 12 months?
Yeah, well, I'll focus on Medicare and Medicaid. It's where I'm most comfortable, and obviously, the national political environment is ambiguous, and I think we're all just kind of waiting to see what happens, and when whatever the decision is, whether it's a hammer or not, um, we have to get to that space. The anxiety, at the moment, waiting for this is it's tough, and you're already, again, I don't think anybody's unique. We're already dealing with budget shortfalls and spiked utilization, and trying to manage our way through all of that. Well, then if there's a huge budget cut in Medicare or Medicaid, well, then you're just kind of piling on, right? So for me, it's staying focused. Today I have an RFP committee, steering committee. I'm going to put all of my attention into the specifics. I'm going to guide my folks. It's the things. It's an old adage. What can you control? What's in your circle of control? And so I focus on that day to day, and I just try to be the best leader I can be. And you prepare as best you can for the worst. And then when that day comes, if it's not the worst, you're in a better off position already, because you've built that structure and that foundation and that strategy. Um, but you know what, I'm honestly and I'm genuinely worried about our seniors and our Medicaid membership, our veterans, the people that need what we deliver. Um, and and I would hate to see, a situation where um, a decision was made that was outside of our control, and cut some amount of our funding. So I think being prepared, be prepared for the worst. Um, and hopefully that's not the result, and then we'll all be better off, and we'll continue to serve the people that need us the most.
Okay. Wise words, uh, as always. So thank you. I had one last question for you before we wrap. If there's one takeaway you want your plan leaders to leave with about last mile engagement today, what would it be?
I'm sorry, one takeaway, what?
Yes, one takeaway that you want plan leaders to leave with about last mile engagement, what would
Oh,
it be?
yeah, I mean, it's so, I mean, we've had this conversation. It's what you do. It is so important. Um, as you that the phrase you use, last mile. And for me, right now, that last mile is that stretch right before you sit down and start hammering out your bid and your product strategies. Get that engagement, get that feedback, and let it structure your strategy. Let it structure where you allocate your money, because you're hearing directly from the people that are giving you real life examples of what their needs are. Is it social determinants of health? Is it supplemental? Is it vision, dental, hearing? Do you need more money on your OTC for needs? Um, don't let the data or your actuary folks, who are probably the smartest people in the group, decide what your benefit and your pricing structure is. it's a component for sure, um, but you got to get that member voice and that member experience. And you've said it multiple times, Shub. The timing of that is important. It's great to get it throughout the year. Maybe have an unplanned advisory council meeting. Maybe have a more direct channel, a timely, more direct channel with that population if you need it. It's hard to do. I know that. I've experienced it, but like we've talked about, it's so important. And again, if you get it wrong, that's 12, 14, 16, 18 months that you got to live with.
Can be very costly. This is great. Thank you so much, Walt, for this great discussion. And as always a pleasure and really enjoyed it. Thank you so
Yeah,
much.
thanks for having me. Appreciate it,
Thank you.
John.